Any organization or service represented in this video should not be considered as endorsed or recommended by Texas A&M AgriLife Extension Service. Welcome to Insurance for Seniors, a webinar of the Harris County Office of Texas A&M AgriLife Extension. We are here to have a conversation today about health insurance, specifically health insurance for seniors, Medicare, and Medicare Advantage. We're having this conversation to speak to our elders, their caregivers, and anyone who handles their business. Today we have a few guests. I am your host, Cindy George. I'm a Master's of Public Health student at the University of Texas Health Science Center at Houston School of Public Health. Our first guest today is Anthony Holmes. He is a sales manager with WellCare. His territory is Houston and Beaumont, and he is an expert on Medicare Advantage plans. Our next guest is Ms. Rose Ortega. She is a certified benefits counselor and information and referral specialist for the Harris County Area Agency on Aging. She has been advising Medicare enrollees for 28 years in English and Spanish. So let's start the conversation. Oh, I forgot to introduce our Texas A&M guests. We have Dr. Sonja Stewart Davis. She is the Harris County Family and Community Health Agent, as well as Carrie Calloway, who is the Community Engagement Coordinator in that office. So let's start the conversation. We're going to talk today about Medicare basics in this episode. And in the second episode, we'll dive deeper into Medicare and Medicare Advantage. So first, let's talk about Medicare basics. We are working through a PowerPoint presentation provided by WellCare. So Anthony, what is Medicare? Tell us a little bit about this health insurance program for seniors.
Well, Medicare is a health plan for folks that qualify for it in a few different ways. It can either qualify by age and working for at least 10 years, 40 quarters, being a U.S. citizen as well. They'll qualify when they turn 65. But it covers their basic needs such as medical, such as hospital needs, doctor needs, and the medical basics that they may need throughout the remainder of their life once they turn 65.
And Ms. Ortega, how do you describe Medicare to the people you advise in Harris County?
Medicare is a federal program, and it's a health care benefit for those who have worked here in the United States and earned credits. So once a person becomes eligible for Medicare or is planning to retire and is needing health insurance, this is an option to consider.
Wonderful. My biggest concern about Medicare when people learn about it and when they're getting ready to enroll or finding out if they're eligible is that a lot of times we hear that number 65, age 65. But one thing that we really need to focus on is that the number really is 64 because the eligibility for Medicare begins 3 months before you turn 64. So can we start there about the power of 64 and tell us a little bit about why people need to recognize that their eligibility begins then and realize they also need to start thinking about Medicare at age 64?
Well, there's a such thing as an initial coverage enrollment period where folks that are going to be eligible for Medicare can start enrolling up to 90 days ahead of time of the month that they're going to be qualified for Medicare. So they get the 3 months before the month they turn 65 or become eligible for Medicare Part A and B, and then the month of, and then 3 months after the month that they turn 65 or become eligible for Medicare Part A and Part B as well. So they get a 7-month period, but it's really important that they take care of it ahead of time, because outside of this enrollment period, the 7 months that we're talking about here, they can incur a penalty if they don't enroll on time.
So, Ms. Ortega, talk a little bit about how you help people understand the right time for them to enroll based on whether they're still working.
Okay, so if they're still working and they hear, a lot of times when they're talking to other people, and they talk about their birthday, I'm going to become 65. That's one of the things I ask, you know, are you working? Are you still working? And do you have health insurance? And if the answer is yes, and then I tell them, okay, let's think about this. Are you planning to retire? Is it something that you're going to do soon? If they say yes, I still explain the eligibility, sort of like what Anthony did. I explain what their options are, and then I tell them to remember to when they do plan to retire, at least 3 or 4 months before, they need to uh, start filling out their application for Medicare. They also need to go ahead and create an account with Social Security, because many times they don't do that or they don't have an account. And so they need to start keeping track of their earning statements they can get from Social Security, which is also an important statement they can review and check on a regular basis, and tells them about Medicare.
And one important thing, not only knowing to start thinking about and taking action at 64, is that really gone are the days where you have to go down to the Social Security office or call and make an appointment, sign in and wait. A lot of this, if not all of this, can be handled online or on the telephone.
That is correct. That is correct. It's easy. I know, sometimes since I've done this for a long time, I can say it's easy, but it is. You just go to the website with Social Security, because they're the ones that handle that enrollment. And again, it's very important that you go ahead and create an account if you don't have one yet.
Okay. So the next thing I want to do is talk about the parts of Medicare. Medicare has original Medicare and Medicare Advantage. And so let's talk about the parts. There are 4 parts, A, B, C, and D. Part A and B are what is considered original Medicare. Part C is considered Medicare Advantage, which can replace Part A and B. And Part D is prescription drug coverage. So Anthony, can you walk us through the different parts of Medicare?
Absolutely. So like you said, Part A is hospital coverage. That's going to cover folks for being stuck in the hospital, things like being stuck in the hospital. Also, hospice care is going to be considered a part of Part A. You got skilled nursing facilities, home health care services, and even nursing home services that are all covered under Part A. Your hospital insurance, and this you qualify simply by, like we said earlier, working the 40 quarters or 10 years total. And you get this when you turn 65 automatically.
And for most people, there is 0 premium.
That's right.
Okay. So Part B, Ms. Ortega, will you talk about Medicare Part B, which is the other half of original Medicare?
Right. That's very important to have. Again, considering if you have other health insurance and things like that. But Part B is medical insurance. It covers you if you're in the hospital, if you're an inpatient. You have to be hospitalized inpatient. It also covers your doctor services outside of the hospital. So for those regular visits, preventive services you can see in your screen, many of us continue with those wellness preventive services that are very important to us and to the men as well. All of that is covered under Medicare Part B. And then also a lot of our immunizations, vaccinations, those are also covered under Medicare, which is also very important for our Medicare beneficiaries. And you mentioned about Part C. It's very important that you have both A and B in order to get C, and I'm sure we'll talk about that. But you know, also that is the basic. Original Part A and Part B are the basic, and that's what everybody usually gets on their Medicare card. You're not going to see Part C listed on there, but that's where we get into more details if they do consider enrolling into Medicare.
And let's back up to the Part B slide. Part A, for most people, has no premium, but Part B will have a premium.
Right, that is correct. They do Part B premium. That premium is usually deducted out of the Social Security benefit. But for those who are not applying for Social Security benefits, they will have to pay that premium. That will be set up with Social Security and Medicare, and they'll be billed on a quarterly basis.
And for the coverage year 2023, that premium is $164.90.
That is correct.
And the amount will
That's the
change.
standard.
Yes, and the amount often changes year to year.
That is correct. Based on Congress, that's announced towards the end of the year what the new premium will be.
Okay, so Medicare Part C, that is where you combine Medicare Part A and B into a private plan called Medicare Advantage. And as I was sharing with Anthony while I was doing my research for this presentation, 2023 was the year where more than half of Medicare enrollees now are covered by a Medicare Advantage plan. So Anthony, can you tell us about Medicare Part C, otherwise known as Medicare Advantage?
Sure. Medicare Part C, Medicare Advantage plans are private health insurance plans that are going to cover everything that Medicare covers. Therefore, it's to cover by the law. And then they're going to have some additional benefits that they'll cover as well. In a lot of different cases, they're going to cover things like dental benefits, vision, hearing, gym memberships, transportation, over-the-counter benefits are sometimes covered, and even a grocery benefit sometimes as well. So there's a lot that goes in, and even Part D as well. In some cases, Part D for prescription drugs is also included in Part C. So Medicare Advantage is just a option that Medicare recipients have to try to get more out of their Medicare benefits for themselves. And in most cases, there's going to be no premium involved. In a lot of cases, there's no premium involved, or a small premium in some cases. But a lot of options do have a no premium plan.
So when you say no premium, that means that $164.90 that most people are paying for B won't be required to be deducted or paid with a Medicare Advantage plan.
No, that's incorrect. That's incorrect. A person that's qualified for Medicare Part A and Part B and decides to get a Part C plan, they do have to continue to pay their Part B premium. Some folks may qualify to not have to pay that premium if they qualify for certain levels of state assistance through Medicaid and things of that nature. Then they may not be required to pay that Part B premium. But anybody that signs up for a Medicare Advantage plan is going to have to read that fine print. Your Medicare advisor, whoever signs you up for that plan, is going to tell you that you are responsible for continuing to pay your Part B premium.
So when you say zero premium, you're saying in addition, for the additional benefits that you're getting, there's not an additional premium.
Right. For the Medicare Advantage plan, there's no premium. You still are responsible for paying your Part B premium, of course. But for the Medicare Advantage plan, there is no added premium, no additional premium.
Even though for the vast majority of Medicare Advantage, you're getting a lot of additional benefits.
That's correct. And some Medicare Advantage plans they're allowed to have a premium. Some of them will have premium. Some private insurance companies do have a premium for their Part C plans, but a lot of folks are seeking a $0 premium plan, and in most zip codes, those are available.
And so the benefit of that is that you would have additional benefits for the same price as your original Medicare coverage.
Absolutely right.
That's
Absolutely right.
the quote unquote advantage for
Correct.
people. Okay, so let's move on to Part D.
Okay.
So Part D is prescription drug coverage. Talk about Part D as it pertains to original Medicare beneficiaries, and talk about Part D as it pertains to Advantage plans.
Sure. So Part D, of course, is going to cover your prescription drug needs. A person on original Medicare that does not sign up for Part D could incur a penalty if they go months without it. So that's not normally the case. Normally, folks will sign up for the Part D even if they don't really need prescriptions, just to avoid the penalty. As you age, as you become maybe more sickly, you never know what kind of medicine you may need. So it always makes sense just to take advantage of the Part D prescription plan when you can. We would always just tell our people that we meet out in the field to sign up for a Medicare Advantage plan that doesn't have a premium, and it includes Part D as well, because a lot of Part D plans that stand alone, they're going to have some premiums involved. So most people would like to try to avoid that. But then you also have your Medicare supplement recipients, people who sign up for a Medicare supplement, and those folks do need a standalone prescription plan, Part D, to cover their medicine. Um, but they can incur a penalty should they go without it as well. But Part D covers prescription medications. There's 4 stages to the Part D plans. As we'll get to that here in a second, I believe. But yeah, there's some small co-pays associated depending on what plan you select. There's a lot of different options, and you can pick whatever option is going to best fit the exact prescriptions that you need. We have tools that would allow us to optimize the prescription medications that you use and tell you which plan is going to allow you to spend the least amount of money throughout the year for the medicine that you have to utilize.
Now, Ms. Ortega, you help people walk through how to select a Part D plan as well. How do you talk to the people that you work with about Part D?
Okay, so I explained the 2 options. I explained the original Medicare option, and then also explain the Medicare Advantage option. I tell them these are your 2 choices. If you select the first choice, which is original Medicare, then you would select a standalone Medicare prescription drug plan, which is separate. And a Medicare Advantage option, which I tell them it's a bundle. It bundles and it includes the Medicare prescription drug plan. And, the questions they ask me, well, what's the advantage of that? I say, well, if you select the first option, you pay these separate premiums. You pay a premium for Medicare Part B. You're going to pay a premium for Part D. And of course, if you decide to add a supplement, then that's your third premium there. Now, with an Advantage plan, because it comes in a bundle, then you have most of the plans, as he stated, include drug coverage. Again, securing, and checking what their other coverage is, because many, retirees or people who plan to retire may have a retiree health plan that includes drug coverage, or for example, our veterans. But with the Medicare Advantage plan, I explained some of the extra benefits that Anthony just mentioned, like vision and hearing and dental, if that's important for them. If they need medical transportation, I let them know about that. If they want to continue with selecting a Part D or Medicare Advantage plan, I use the Medicare.gov website to help us and help them consider their options. We usually do a 3-plan comparison. I enter their medications and I tell them, nothing is saved. Everything, It's just a general plan comparison. And then I, slowly, um, after I enter their medications and enter their preferred pharmacy, I go into details. I explain and review the different options. I review the cost of medication. I review their pharmacy because that's very important on if they choose Medicare Advantage plans. They get their best cost if they choose those preferred pharmacies. I and then there's also the standard pharmacies. So again, if it's not a preferred choice for that plan, I make them understand that. But that's what I usually use is the Medicare.gov website for that.
And when we're talking about medications,
Mhm.
one word that people need to understand is formulary. And the formulary is the list of drugs that are covered by a Part D plan.
Correct.
And you want to make sure, first of all, that your prescription medication is on the formulary.
That's
Now,
correct.
explain when you say preferred, that means that your copay may be different or higher for that particular medication.
Correct. There's different tiers. These plans have different tiers. There's tier 1, tier 2, tier 3. So usually the first three tiers, that is either a preferred or it's a medication that is either a generic. So those going to be under those first tier 1 or tier 2 or tier 3. So again, I tell them that's very important. And it's also very important that they choose a pharmacy that is preferred by that particular plan. And again, it's different. It just depends on the company that they choose. Another thing is I tell them, don't worry if the prescription is not covered, because all the Medicare Advantage plans, it's a rule, it's a guideline that they have to have an exceptional rule in there. So if a person is taking a medication or in the future they get prescribed a medication, the doctor can submit a request to these plans to have that prescription approved. So again, it depends. They have to work and speak with the doctor, have that conversation with the doctor, and can help them file that exception on their behalf.
And one of the reasons why I hope this conversation is so helpful to our viewers is because there's a lot to do, a lot to consider. There may be a lot of back and forth when you are trying to figure out the best Medicare plan for you and to make sure the services you need and the prescription medications you take are covered.
That is correct. We tell them it's very important that they gather all the medications they're taking or they've taken before. Sometimes they stop taking some medications, but they know they've taken it before. They just want to know what the cost is. But again, what's viewed at Medicare.gov, or sometimes we go into the plan's website, if we want to see more details, we review those options. But we tell them, the best way to get the actual cost, because these are just estimates. Again, we let them know that these are estimates and things can change, when it actually goes into effect. But again, we always give them the plan's phone number, contact information if they want to follow up, and get more details on the coverage.
And so we have talked a lot about the basics today, and I want to wrap up this episode by looking at one last slide regarding your options for Medicare and your options for prescription drug coverage. So let's review. The number for your age is 64. It's the month you turn 65, 3 months before, and 3 months after. So you have a 7-month window to apply for Medicare. Your two main options that you need to consider are Original Medicare, Parts A and B, or Part C, which will include A plus B plus additional benefits, as we see at the bottom of this WellCare slide, and then Part D. For Part D, if you have original Medicare, you will need to buy a standalone prescription drug plan. If you have Part C, Medicare Advantage, your prescription drug plan, Part D, is often included in that Medicare Advantage plan. Sometimes it may be a standalone plan. As we wrap up these Medicare basics, Anthony Holmes, is there
Yes.
something you'd like to say to wrap up this episode of Insurance for Seniors?
Absolutely. If anybody has any questions or concerns regarding their Medicare or their options for turning 65 and being eligible for Medicare, I'd love to be able to speak with you and help you out. Again, I'm Anthony Holmes. I'm the sales manager here in the Houston, Beaumont, Galveston area. I can assist anybody in the entire state of Texas with their Medicare options. If I could leave my phone number here, I guess I would.
How
Yes.
can people reach you?
Okay, you can reach me on my cell phone at 214-695-5371.
Thank you, Mr. Holmes. And Ms.
No worries.
Ortega, how can the people reach you at the Harris County Area Agency on Aging?
Yes, they can call our call center, and the number is 832-393-4301.
Thank you so much for joining us for this episode of Insurance for Seniors, discussing Medicare and Medicare Advantage basics. We're having this conversation for our elders, their caregivers, and anyone who handles their business. Thank you so much to all of our guests, and thank you for watching. Any organization or service represented in this video should not be considered as endorsed or recommended by Texas A&M AgriLife Extension Service.